So a lot of people are freaking out about the virus going around. People don't really know what to think. They don't know what to believe. People don't know how to protect themselves. It's hard to know how serious it is with the media and the way they're reporting everything. The stuff that they're reporting, the stuff that they're not reporting. It's hard to assess that information and determine for ourselves what to actually think. You see a lot of people buying Lysol wipes and hand sanitizer. But what about our immune system? What kind of information do we need to know about our immune system when it comes to infections and viruses? And that's kind of what I want to talk about today. I kind of want to inform people and equip people with the information regarding the immune system, how it works, how vitamins play a huge role in that, and so on and so forth. So I'm going to be talking about vitamin A, vitamin D, vitamin C, zinc, and vitamin B6. Those are the fundamental vitamins, I believe, for supporting the immune system. I have this book here as a reference I'm going to be kind of going over. And then I have some studies in reference to each vitamin, just scratching the surface about each vitamin, what they kind of do, how they bolster the immune system, how the immune system kind of works and functions. Proper sanitization, washing your hands, cleaning surfaces, your phone, doorknobs, all that stuff is important, obviously. But if you don't have the fundamentals supporting your immune system, you're going to be living in a bubble for your whole life because you're exposed to viruses, bacteria, infections on the daily. It's nothing new. So that's what I'm here to talk about today, is just vitamins, nutrients relating to the immune system, how they function, their roles, their importance, just scratching the surface. This is not new information. Most of this information is just reiterated by very, very good doctors who know their stuff, who treat patients with chronic infections, chronic toxicity issues. So I'm fitting the role of just delivering information, the right information, in a time like this where people are kind of being driven by fear and not having the right information being equipped or delivered to them. I feel that I could fit that role of bringing the right information forward, redirecting people's focus onto what is actually important. Orthomolecular medicine for everyone, Abram Hoffer, MD, PhD. Who's at risk? Vitamin A, D, C, and zinc. People that are deficient in those vitamins already are at risk as they're essential for immune strength. Vitamin A is important for mucous membranes and cell membranes. Vitamin D is important for immune programming. Vitamin C and zinc are important for white blood cells as resources for attacking pathogens and metabolizing them, as well as zinc is important for building white blood cells. So who's at risk? Pre-existing health issues, immunosuppression. Of course, people with immunosuppression through various drugs, chronic toxicity or chronic infection, those people are going to be at risk. People with asthma or pre-existing respiratory issues, as a majority of viral infections hit the respiratory system. Those with already respiratory issues are going to be a little more fearful, but there's lots you can do about that people aren't learning about. So we can go over a few of those things. Those with lipid peroxidation. This is one of the more scary groups, autoimmune issues, as lipid peroxidation is the breakdown of your cells, cell membranes, through the fat breakdown of the cell membrane. So you have lipids, fats that make up your cell membrane. And once you have peroxidation of those membranes, the cell becomes exposed and leaky. This usually is from chronic fat soluble toxicity. A lot of toxicity issues and toxins will bind to fats, and that's where you kind of get that issue. Vitamin C history. This is essentially talking about vitamin C is essential for being supplemented or being taken into the form of our diet. That's where we need to get it, as we don't produce vitamin C like some animals do. So that's important to know that we need to get it through our diet or supplementation. Decreased resistance to infections. So vitamin C is associated with decreased resistance to infections. As we can observe through this reference, a relationship is made through the Black Death or the Black Plague. So the Black Death was so terrible because it was superimposed upon pre-existing scurvy. So scurvy is associated with vitamin C deficiency. So there's a relationship here made that vitamin C deficiency pre-exposed and made these people vulnerable to getting the plague or the Black Death. So 1/4 of the population, 25 million people died, which is a big number. What does vitamin C actually do? White blood cells need vitamin C for peroxisomes and lysosomes, which are organelles inside white blood cells that are needed for digesting ingested material. So white blood cells go around engaging pathogens and fighting them, such as viruses, bacteria, parasites. Once they come across them, they ingest them, engulf them, and eat them. A process called phagocytosis occurs, where the ingested material is broken down. Vitamin C is needed for that process to perform phagocytosis through peroxisomes and lysosomes. So it's a very important function. A reference here in the book: leukocytes, white blood cells, actively seek and transport ascorbic acid to damaged tissue. That's pretty important. Leukocytes also require ascorbic acid for making globulins and for phagocytosis, ingesting bacteria and other invaders. Leukocytes are so avid for ascorbic acid that when too little is present, they'll retain enough to cause scurvy in other tissues. Up to 7 grams of ascorbic acid each day may be required merely to satisfy the leukocytes' requirement for vitamin C. So obviously there's a pretty big role for vitamin C if that much vitamin C is needed by leukocytes and white blood cells. Obviously fits a very big role in fighting infections. Conditions benefited by vitamin C. The importance of vitamin C cannot be overemphasized. Vitamin C has been shown to be helpful in fighting over 30 major diseases, including pneumonia. There you are, your respiratory viral infections, pneumonia, arthritis, cancer, leukemia, on and on and on and on. So it has a lot of different roles for fighting disease. The next page, pneumonia is emphasized again. Successfully treated chickenpox, measles, mumps, tetanus, and polio with huge doses of vitamin C. The following is a complete list of the conditions that responded to high dose of vitamin C. That's really good. The common cold. The problem with investigating the common cold is not as common as it's thought to be. The term cold is applied to any acute, short-lived viral infection of the upper respiratory tract. So there you are, respiratory tract, infection of the respiratory tract. So vitamin C helps with respiratory issues and viral infections. Ascorbic acid does indeed prevent many colds and improves the symptoms when it is present, but in our opinion works best for the real common cold, the one that is due to a virus. So emphasizing antiviral properties of ascorbic acid, vitamin C, this doctor knows that vitamin C is important and serves that role. So that's good. Next we have zinc, white blood cell enzyme function and ammunition. Dr. Dietrich Klinghardt, a German medical doctor, one of my favorite doctors, who treats chronic infections such as Lyme disease, viral infections, bacterial infections, parasite infections. This is a statement here. White blood cells without zinc are like an army without bullets. So that's a pretty strong statement coming from a doctor who treats patients with chronic infections, such as Lyme disease, which is very difficult to treat. Here's a clip of a study that I pulled, zinc and immunity. Zinc affects multiple aspects of the immune system. Zinc is crucial for normal development and function of cells mediating innate immunity, neutrophils, natural killer cells, macrophages, phagocytosis, intracellular killing, and cytokine production are all affected by zinc deficiency. So that's a lot of different roles for one nutrient as well. For zinc, it's involved in many different aspects of killing infections and pathogens through white blood cells. Next we have vitamin D, immune programming. Vitamin D programs through VDR receptors that are present not only in the intestine and the bone, but in many other tissues, including the brain, heart, pancreas, white blood cells, skin, and gonads. Vitamin D is thought to protect against respiratory infections by boosting levels of antimicrobial peptides, natural antibiotic-like substances, in the lungs. Results of the study fit with the observation that colds and flu are commonest in winter and spring, when levels of vitamin D are at the lowest. They may also explain why vitamin D protects against asthma attacks, which are commonly triggered by respiratory viruses. Here we are seeing respiratory viruses and respiratory issues again being resolved with another vitamin. Daily or weekly supplementation have the risk of acute respiratory infection in people with the lowest baseline vitamin D levels. So it's a good role as well. Vitamin D metabolizing enzymes and vitamin D receptors are present in many cells types, including various immune cells such as antigen-presenting cells, T cells, B cells, and monocytes. B cells help with producing antibodies. T cells go out and hunt and kill pathogens. So that's a heart of your immune system right there. It's a pretty big role. Here I have another study for vitamin D. The possible role of vitamin D in infections is implied from its impact on the innate and adaptive immune responses. So your learning part of your immune system right here. An adaptive immune response is your learning immune response. Vitamin D affects that. Significant effect is also the suppression of inflammatory processes. So your cytokine response and your cytokine storm are modulated through vitamin D. Because vitamin D could be acknowledged as a seasonal stimulus, it'd be crucial to prove from a potential easy and cheap prophylaxis or therapy support perspective as far as influenza infections are concerned. So treating viral infections again, influenza. Through VDR, vitamin D can also modulate the innate and acquired immune system. This is emphasized again. This has prompted the idea of exploring the impact of vitamin D on the efficacy of our immune system in fighting off difficult-to-treat viral infections, such as influenza, especially because reaching an optimal level of medicine is cheap and easy for everybody. Yeah, vitamin D is pretty inexpensive, same as vitamin A and zinc. It doesn't take a lot of money to support the immune system. And then we have vitamin A. Vitamin A is important for your mucous membranes and your cell membranes. Gives you healthy mucous membranes, strong immune system, and helps prevent cancer. May decrease mucus secretion and increase susceptibility to colds. Vitamin A deficiency increases your susceptibility to colds. That's important to know. How many people have been told that? No one's learning this stuff. It's frustrating because it's really simple. If you're vitamin A deficient, you're already at risk for getting a respiratory infection. May be thought of as a surface membrane vitamin necessary for the health and skin of the appendages, mouth, respiratory membranes, gastrointestinal tract, respiratory membranes. It's important information here, and it's not. This information isn't mainstream. Why? Like I've heard other doctors talk about it in functional medicine and functional nutrition, but it's not on the news. They use vitamin A to treat measles, actually. Vitamin A is really good against viral infections. Vitamin A deficiency is more serious and more common, blah, 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 blah. Respiratory system is more susceptible to infection by decreasing mucus secretion if you're deficient. The respiratory system is more susceptible to infection because of decreasing mucus secretion. That's a really important statement. So vitamin A. So vitamin B6, P5P, the bioactive form. I just quickly put this together last minute here. I wanted to show this, the importance of vitamin B6. Lymphocyte differentiation and maturation. Antibody production is indirectly reduced if you're deficient. Vitamin B6 serves over 113 different functions. That's a lot of different areas where things can go wrong. So having a vitamin B6 deficiency is going to create some issues in the immune system for sure. One last thing I'd like to add is something I call the 3S rule. Sugar, sleep, stress. Too much sugar, too much stress, not enough sleep is going to suppress your immune system. I think it's like a teaspoon of sugar suppresses white blood cells for like 8 hours. So if you feel like you're getting sick, or you feel like you're scared of getting sick, just lay off the sugar, get more sleep, try and reduce stress. That part's kind of hard right now, but yeah, that's important to pay attention to those three things, the 3S rule: sleep, sugar, stress. So vitamin C, vitamin D, A, zinc, B6, I'd consider these the fundamentals in supporting the immune system. There's many other vitamins and nutrients that are important, but these are the ones I wanted to cover today. If you're wondering what I take AOR. Very good high quality supplements that are pure, gluten-free, GMO-free, dye-free, filler-free. I've used them for a long time and they're really good. You can find them on my store, equilibriasupplements.ca. Put a link in the description. So vitamin C, pure ascorbic acid crystals in capsule form. Zinc copper balance. This is important to have a ratio of zinc and copper together because they displace each other, so taking too much of one is going to lower your levels of the other. P5P, bioactive form of B6 for people that have trouble converting their B vitamins. Antioxidant synergy. I kind of wanted to mention this one because I mentioned lipid peroxidation. So this supplement is directly made to support lipid peroxidation and prevent it. It has vitamin E, which does that, as well as other antioxidants such as NAC, selenium, vitamin C, and coenzyme Q10. And then I have vitamin D in liquid form, very good supplement. I don't carry vitamin A, but this is the one that I use. Vitamin A by Genestra in liquid form. So if you like the information and you like the supplements, please give a like, share the video, and take care. Thank you.